Let's talk about hemostasis, not homeostasis, but hemostasis, which is the physiology of blood clotting. Blood clots whenever there is any damage to the intact endothelium or the simple squamous epithelium. So when we talk about blood clotting, we normally think about a finger being cut or any of the cuts that we have on the epithelium on the outside. But just pause for a minute and think about what if there is a cut inside your body, not on the skin, but inside of your body. The same process has to take place. We cannot lose blood internally as well. So stopping of blood or cessation of blood flow is called as hemostasis. And as long as the endothelium, which is the innermost lining of the blood vessels, is intact and it's nice and smooth, the blood will flow. If there is, it doesn't even have to be cut. If there is anything stuck to it, for example, cholesterol, then that can start the inflammatory process. It can start inflammation and it can draw platelets to come and stick to it. And that is one of the most common reasons of plaque formation or atherosclerosis or arteriosclerosis. Okay, so let's talk about blood stopping, okay, or if there is a bleeding, how to stop the blood. So if there is a break in the wall and the blood may start to seep into the tissue, so it has to go through blood clotting. So for blood clotting, before we even talk about the factors, I'll come back to this. There are three steps that take place. So the first one is vascular spasm or vasoconstriction. So whenever there is a damage to the connective tissue of the blood vessels, the smooth muscle starts constricting. Okay, so the cut or the injured tissue, right, starts producing some chemicals, and those chemicals are vasoconstrictors. Okay, so they will start constricting so that, again, to stop the blood flow. And these chemicals also draw or have like a chemotactic response on the platelets. The platelets come to that area, and platelets, once the platelet comes to the area and starts sticking to the injured blood vessel, there is a positive feedback where more and more and more platelets will come, eventually forming a plug. And this is a temporary plug. This is not the actual clot. So it forms a temporary platelet plug just to stop the flow of blood. And then by that time, you have the coagulation which starts. So you have a complex substance. I'm just talking about the end of this process. So you have a complex substance called as prothrombin activator, which is formed, and that converts prothrombin to thrombin, which converts the fiber, the soluble fiber in the blood, which is called as fibrinogen, to fibrin, which is the clot. Okay, so that is going to trap the blood cells and everything, all the debris around it, and effectively form a clot. So what all does it require? It requires, let me go back, it requires vitamin K and calcium ions. Calcium ions is one of the factors. So when we talk about the coagulation, when we talk about the blood clot, we are talking about 12 different factors or 12 different substances that are found in the plasma. One of them is calcium ions. And many of them are plasma proteins, and they are produced by the liver, okay, in the presence of vitamin K. So suppose I ask, okay, what dietary components are required for clotting of blood? You have to say calcium ions and vitamin K. These two are essential. And of course, we need all these 12 factors. Okay, so you see like there are 13. Two of them are the same. So factor 5 and factor 6 were found to be the same. So this is left blank, and that's why we have 13. But in all, we have 12 clotting factors. So let's read them. So clotting factor number one is called fibrinogen. That is the actual what forms the clot. Prothrombin, we just read about it. tissue factor, that's number 3, calcium ions, see, proaccelerin, proconvertin, anti-hemophilic factor, plasma thromboplastin component, Stewart factor, plasma thromboplastin antecedent, Hagman factor, and fibrin stabilizing factors. So these are 12 factors, and good news, you don't have to memorize any of these. I'm going to talk about intrinsic and extrinsic pathways, and you really don't have to go deep into that. Okay, so don't worry about that. So here we are, these are all plasma protein, plasma protein, plasma protein, plasma membrane glycoprotein. Calcium is the only inorganic ion. Plasma protein, plasma protein, plasma protein, plasma protein, plasma protein, plasma protein, a plasma protein activated by negatively charged surfaces, and plasma protein. So all of them except one are plasma proteins, and they're all produced by liver, right? So that's how important liver is for production or for helping blood to clot. If liver is damaged, it cannot produce plasma proteins, okay? So it doesn't, the blood doesn't clot. And if you see into this, most of them require, see all these with the asterisks, they require vitamin K, okay, in order to produce that particular factor. So calcium and vitamin K are 2 dietary components, very important for blood clotting. And if we talk about organs, liver is the most important organ for blood clotting. So hemophilia is a disease which can be caused if any one of these factors are missing. Hemophilia, the hemophilia A, hemophilia B, hemophilia C, these are genetic disorders. So if this particular plasma protein is not present, okay, if something, and again, as I said, these are genetically determined. If there's any problem, that leads to hemophilia. Okay, so let's continue. So coagulation, so the final product is you need to have prothrombin activated, which converts prothrombin to thrombin, which is factor number 2. And that converts, thrombin converts fibrinogen to fibrin. So it's almost like a domino effect, okay? So don't have to memorize all this, but I do want to talk about the whole phases. So there are 2 different pathways, intrinsic pathway and extrinsic pathway. So extrinsic pathway is when you have an external damage, right? Intrinsic pathway is when you have some kind of bleeding inside, internally. So here you can see like how you have that cascade effect or a domino effect. 12, so you have vessel endothelium rupturing, exposing the underlying tissues, right? So platelets will cling and then they will start mobilizing the factors or activating the factors. So you have 12, which is converted to 12A, that converts 11 to 11A, that along with 7A and calcium is going to convert 9 to 9A. And after a point, then you have a common pathway. 9A and PF3, which is platelet factor 3, is released from the platelets, from the clumped platelets. They are going to convert 8 to 8A. So 9A and 8A complex is going to convert 10 to 10A, and that in the presence of calcium, and PF3 again is going to convert 5 to 5A, which is the prothrombin activated. Okay, so this skips some steps. So you have tissue factor, which is going to convert 7 to 7A, which may go and start this process, or it forms this tissue factor and 7A complex, which is going to convert 10 to 10A and so on, and forming the prothrombin activator. And then you have the prothrombin activator, which is going to convert prothrombin to thrombin, and that is going to convert fibrinogen to fibrin, and that is the clot. So that's all I want you guys to understand, like what are the different factors. You don't have to know the names. They are plasma proteins, liver is important, calcium is important, vitamin K is important, and you have these 3 major stages of clotting, and then the final stage, and you have intrinsic pathways, extrinsic pathway, and the final stage is where prothrombin is converted to thrombin, fibrinogen is converted to fibrin. That's all you need to know. Okay. And hemophilia is a genetic disorder which can be missing. Any of those three factors missing can cause hemophilia, A, B, and C. Bleeding can take place if there is no vitamin K. Bleeding can take place if there is insufficient calcium, along with other problems. Bleeding can take place if liver is damaged. Okay, so those are some of the things that you need to know. All right. When we talk about the disorders, the biggest thing is thromboembolic disorders. Thrombus means a blood clot in healthy blood vessel. And if it is stuck to the blood vessel, it's called thrombus. If it breaks loose and starts traveling, then it is called as embolus. Embolus is very dangerous because it can go and lodge itself in these tiny capillaries like in the lungs or heart or brain and cause pulmonary embolism, can kill a person, or a heart attack or a stroke. And these are essentially life-threatening diseases. Okay, so especially emboli. And if a person is prone to have blood clots, then they are given drugs like aspirin or heparin or warfarin, any of these blood thinning agents. And so these heparin is an anticoagulant found in saliva of like tapeworm. Okay. So warfarin is Coumadin, which is very commonly used. And bleeding disorders, so this was thromboembolic, that is clots. Bleeding disorders is when if there is a cut and it doesn't stop. The most common is thrombocytopenia, which is insufficient or absence of platelets. Okay, so even the small vessels start to bleed on the surface, and those are called as petechia. Liver malfunctions, okay, so coagulation factors are not produced, vitamin K deficiency, or abnormal fat absorption, right? If fat is not absorbed, vitamin K is a fat-soluble vitamin, so they are found in the fat reserves. And hemophilia is a genetic disorder, mostly from the deficiency of factor 8, okay, that's hemophilia A, and then B and C, which we just saw. So here are some of the disorders which is actually given in this. So septicemia, thalassemia, right? Thalassemia we saw in the blood where you have, if the hemoglobin is not formed properly, that leads to thalassemia. Infectious mononucleosis, again, mono, right, affecting the monocytes. And then disseminated intravascular coagulation. This is widespread clotting, could be genetic as well, okay? Thrombocytopenia, where the platelet count is much, much low than normal. Okay, so these are some of the diseases that we see. So I wanted to put this picture in. This even is continued now in some countries. These are leeches, right? So leeches have a blood thinning agent, and when a person has like a wound and when they have swelling, okay, leeches are introduced so that they can suck up that extra fluid, and that is a cure. Okay, so it is very effectively used, and if this was given to me, I would use it. All right, I know it looks really right, but this is like a nice fat little leech that you see here. So leeches have like these kind of jaws, and they produce this anticoagulant. So once they latch on, they produce that anticoagulant so that the blood just freely comes into their bellies. Okay, so it's difficult to take them out. So they have teeth that digs into your skin, but this is commonly used in cleaning up wounds. All right, thank you. So this is the last part of this chapter.